All right. Good morning. Welcome everyone to the Wednesday, November 1st, 2023 meeting of the Health and Wellness Advisory Committee. We've got a great group on board this morning, and I appreciate all of your time and everybody jumping in. I know it's a busy time, and I appreciate everybody giving a little bit of your time to our committee this morning. Hope everybody survived the ghouls and goblins last night. I know I enjoyed sitting out on my front porch last night and seeing some of our neighborhood kids come by in their great costumes, and it was a good time. But hey, it's November now, the month when we roll back the clocks this weekend. We get that chill in the air. We start to enjoy some local oysters and gather them with family for Thanksgiving, and it's a time that we really love. Also want to mention that it's Veterans Day coming up next Saturday, and we want to remember our veterans, and obviously have them in our hearts. And Paul's got it arranged where we've got someone from the Veterans Administration that's going to speak with us in our meeting in December. So we look forward to that as well. And November is also Family Health History Month, so which with Thanksgiving, it's a good time to share important family health history. So and gather some information, let your doctors know about your family health history as well. So again, like I said, we've got a great meeting up ahead, and our next agenda item is to approve the meeting minutes from October 4th, 2023. Can I get a motion to approve those minutes, please?
Make the motion to approve.
Thank you. Got a motion to approve. Can I get a second?
Second.
All right. Thank you. Nick has seconded. And any discussion on the minutes from last time? All in favor of approving the minutes, please say aye. Aye.
Aye.
Aye.
Any opposed? The minutes have been approved. So, and this morning we're very fortunate to have Layla Luna, the founder and CEO of Just Be, and she's our guest this morning, and we're very excited to hear about her program. She was telling me a little bit about it. I won't steal her thunder, but I will let her kind of take it from here, if you would, Layla.
Well, good morning, everyone. Thank you for having me, and hope you had a happy Halloween. I'm Layla Luna, and I'm the founder of Just Be. Just Be is dedicated to the millions of families with autism spectrum disorder. I'm going to go right into my PowerPoint. Yes, here we go. This is Just Be. Give me one. Is everybody on? I'm trying to just show you.
We're trying to share this. Hold on.
It's not letting us share.
We have it.
Oh, you can see it, but it's not letting us advance. There we go.
So, my story begins with that my dream in life was to be a mom. That was my dream. And my dream came true in 2010 when in 2008, my son Rio was born, and it was the happiest day of my life. He was beautiful like every other kid. Nothing was wrong. But in 2000, it was in 2010, he was diagnosed with autism spectrum disorder. And at the time, all I knew was that he was different, but there wasn't much known about autism. All I knew was Rain Man. That was like the only resources I had was Rain Man. But I quickly learned how to navigate through autism. And at the time, most people, when I would say my son's autistic, they would say, oh, he's an artist. I mean, there was very little information, but I navigated. And in 2018, I wanted to take my daughter and my son out for pizza, and we went to this local pizza restaurant. But on that particular night, it just took forever for us to get seated, to get the check, get the pizza. And Rio had what they called a sensory overload meltdown. He started screaming and crying and banging his head. Next thing I knew, all the customers around me started yelling at me to control my kid. What kind of mother am I? And that he was a spoiled brat. And then the restaurant kicked us out. And there I was in this total Mayday situation, panicking outside. All I kept thinking about was, why can't people just be nice? Why can't they just be kind? Why can't they understand that he's autistic? I remember going home completely defeated and waking up the next day. And all I kept thinking about was, what if that restaurant had known that Rio was autistic? What if they were trained in autism? What if they had just seated us right away? Would that night have gone down the way it did? And that was the call to action, to become a 501c3 and to try to teach businesses how to become sensory friendly and welcoming environments. One of the most important things I want to talk about with autism is that there is no facial recognition. There's no look to autism. My son looks absolutely typical. So when we're out and he has a sensory overload, people always tend to think, what's with that mom? Discipline your kid. And that is the big disconnect. If it was Down syndrome or a visible disability, people would then, they would have a different type of reaction. So this is what I'm really advocating for. My goal is to make Charleston, the sweetheart of the South, one of the first certified autism-friendly cities. If you look at autism, it's an overlooked community. There are 5.4 autistic adults in the US, 53 Americans with disabilities. 1 in 28 in South Carolina have been diagnosed with autism, and there's a 3-year wait list for individuals that are on this trying to get an IEP, an individual education plan, which is so important. It's a growing demographic. $262 billion is spent on autism-related services in the US. Again, the CDC came out that is now 1 in 36 children have been diagnosed with autism. I do believe that's a higher number, mainly because that's the ones who have been diagnosed. And we know that that is a very difficult process. It's not easy. Autism occurs in all racial and ethnic and socioeconomic groups, and autism is up 600% increase. One of the things that I'm going to touch on just a little bit is that autism is one of the biggest and largest untapped markets in tourism. This could also be very important for the South because it could lead in autistic travelers and their families. 22 million autistic families around the world. I know that 87% of all autistic families do not take family vacations. I've never traveled with my son, who's now 15. And not only is he 15, he's nonverbal autistic, which is 40% of individuals with autism. Autism is the fastest growing developmental diagnosis in history. The medical community believes that and they estimate that it will surpass diabetes by 2025, which is a huge number. And again, no facial recognition. There's no way to identify this. 93% of autistic families said they would travel if they knew a place was welcoming and kind and respectful. This was one of the leading things that kind of made me start Just Be. And to touch on that, the advocacy of it would mainly be that here in the South, when I campaigned to try to get Mount Pleasant certified, which is one of the first certified towns in the Low Country, I campaigned on a slogan, Just Be Southern, because all I'm asking is Southern hospitality, to be kind and to be welcoming. So it's not a huge stretch. It's about the whole community. You can see that this affects hospitality, education, healthcare, entertainment, government, and public safety, and the workforce. Things that we do know about autism. A person with autism on the spectrum, whether they're verbal or nonverbal. So you have 40% of adults or young children that are nonverbal, like my son. But in a high sensory overload situation, anyone, even if they are verbal or high functioning, will become nonverbal in a stressful sensory overload. Again, some of these, there are 5.4 million autistic adults. 50% of people killed by police have a disability. They are 16 times more likely to be treated and untreated with mental health illness, more likely to be killed by law enforcement. So this is one of the biggest fears as a parent about having a child with autism, especially a nonverbal, is whether they would be able to express themselves in a high sensory overload situation or with law enforcement. I believe that this is something really important that we talk about, because as of now, there's really no safety measures. I was with the Governor McMaster, on Monday, and we did sign into a bill to add to the alert system individuals with autism and neurodiversity, which it would be very important because there is really no database to gauge what would happen if my son were to get lost. And something very important to talk about is that, I mean, how would Rio call 911? He doesn't talk. If there was an emergency situation, how would any individual be able to ask for help? I have a little bit of a cold, sorry. So one of the best things I thought about, which would really help save lives, is to change our driver's license, to have some formal ID in place, because our first responders,
Okay, I've got somewhere to go this afternoon, but but I'm in my
He's
city.
not on. Our first responders and our police have seconds to decide whether that 250-pound 6'3" individual coming at them flailing, are they on drugs, or could they potentially be having a sensory overload situation? Adding the Just Be logo to the driver's license and the license plate, we do it for handicap, we do it for military. This immediately would send a signal to law enforcement that this individual is on the spectrum, and they wouldn't shoot. I'm trying to prevent and save lives. I know that some of the family members that I've worked with, their biggest fear is that their high functioning child drives, and if they were to be pulled over, they wouldn't know what to do in that situation. But this is a clear identifier to help any family or individual prevent something that usually doesn't go in the best benefit for the individual on the spectrum. We don't have a database, an ID card. My son being 15 and nonverbal, he's never going to drive. But if he were to get lost, it's over. What would I do? He has no way of being able to express himself. But if there was a database and being able to do a digital ID card through, Just Be does have an app. It's like the Yelp of autism, to be able to connect these families. We've done this in Mount Pleasant with Wake Up Carolina. They do go in live time, FaceTime, with a mental health expert to help an individual who's struggling. We can add this to be able to find any person who goes missing. A lot of individuals with autism, it's 140 times more likely to drown. One of the biggest, 90% of most individuals with autism who end up passing away is due to drowning. This would help, having an ID card to be able to tell police officers immediately, this is Rio, he's nonverbal, he's not on meds, he might bite, he might hit your head, he will be scared. This is my information if lost, because eloping tends to be a big factor in individuals that are on the spectrum. This would also be an amazing safety training. Just Be does have a training curriculum designed by one of the leading doctors in its field, Dr. Diane Cullinane. And she wrote a training curriculum for first responders, a lot of emphasis on nonverbal. That's really not talked about. And again, going back to what I said earlier, any individual in a high sensory overload situation will lose language. This is 100% known. The sirens, the lights, the fear, people coming at you. It's intimidating. Can you imagine someone on the spectrum? An individual on the spectrum that's having a sensory overload is almost like an individual that has PTSD. It's very similar. I created a symbol and a sticker that you can put on cars, and it's for nonverbal B, signifying that the individual doesn't have communication. This would be, imagine in a car accident, you know, cars have baby on board. This would be a symbol to, again, time saves lives, for law enforcement to know, or to even have a pin or sticker so that my son would be able to express and see the officer wearing this, knowing that, oh, there's nonverbal. This individual cannot communicate in a sensory overload situation. And we can now understand that there's nothing else affecting him, that this is autism or he is on the spectrum. We really want to focus on safety because with the growing numbers of individuals on the spectrum, we don't have a plan in place. And I'm here to save my son's life in case something were to happen to him. Nonverbal, people who are nonverbal speak, they cannot speak, but a lot of them have these kind of, like, if it's whether a PEC system, or they might have an iPad where they're a communication board. This is really important for them to be able to communicate, whether it's pictures or their typers. It's called rapid prompting method. That's what my son does. So this is one way you'll see individuals that are communicating that are nonverbal. Please understand that an individual that is nonverbal, they understand, they have feelings, they hear you. A lot of the time people think an individual, if they are non-speakers, that they don't have feelings, which is so wrong. My son understands 3 languages fluently, but he can't tie his shoes. So the depths are, you know, it's very challenging to express to public when you're used to having typical individuals, that a person that doesn't have communication doesn't mean they're not smart, doesn't mean that they cannot be effective in their life. Here's some things I'll let you guys just kind of look through to recognizing autism. People that they have challenges communicating. A lot of the time, they won't make eye contact. It's hard for them to make eye contact. They may feel a little bit confused or with a lot of anxiety when they have to look at you directly. But that doesn't mean, again, that they don't hear you. They may have a hard time, difficulty recognizing and responding to social cues, a wave, a point, a facial expression. An autistic person might have limited language. The spectrum is huge. Some of the greatest minds have been on the spectrum, so that doesn't mean that they're not intelligent. One thing that we do know from individuals with autism is that they really seek relationships and communication. They want to have friendships. They long for love, everything, the same things that any person like ourselves feel, they feel too. An individual with autism is 6 times more likely to commit suicide due to loneliness and isolation. We call it the cliff. A lot of autism is focused on early intervention, which is important. The early stages of getting diagnosed and getting treatment. But there's another chapter, it's called the cliff, that's what they call it, after 21. If you have an IEP, if you have one, you can be in school till 21, but after that, there's no schools. You can also recognize the fact that if something were to happen to me, my son would be a warden of the state or homeless. There's not enough homes. So this is the fear. Most parents like myself, we know that we're going to raise our kids. I had a mom tell me, you know, her dream in life is to outlive her daughter because she has no idea what she would do without her. And that's what most parents like myself feel, that the future of this cliff is unknown. And you can see here that autism is truly a spectrum. Some of the greatest minds, Newton, Mozart, Beethoven, Einstein, Elon Musk, Steve Jobs, Bill Gates. We don't know who's in our community. We have diamonds in our community if we were to just celebrate brain differences and think outside of the box. The benefits to the community, well, you have better quality of life, definitely more tourism. Most families that would come to Charleston because it's fantastic and it's one of the most wonderful places. It wins all the awards every year, but a lot of families would also come on off season. Most of us would travel on not the busier times, or we would go to businesses on slower hours of operation, which is really important because that creates a beautiful revenue model for businesses on their slower hours. Autistic individuals or anyone on the spectrum make incredible workers. They're excited to work. We have about 70,000 jobs where there's spaces for individuals that are neurodivergent to be on the spectrum. One of the most important things is DEI, diversity, equity, and inclusion. This is very important, but most don't know that neurodiversity is part of DEI. People, they think most of the time it's gender, race, sexual orientation, but they don't include the disability of the neurological brain differences. Neurodiversity is a civil right under our Constitution. So that includes intellectual disabilities under neurodiversity. And again, these individuals make incredible workers. They want to work. We have to decide as a community, what does it mean to be successful? What does it mean to have purpose? Does purpose mean in success that you have $1 million? Does it mean you have a college degree? Or could my son be able to work at Walmart and just open and close the door and have a fulfilled life? For me, that's enough. And that's what we have to change the narrative of how we're thinking about this community moving forward. These numbers you cannot deny. We have our community, we have a generation of young adults living in their room on an iPad, and it affects the whole family unit. It's not just my son who's orbiting the earth by himself. We're a family unit of 5. It affects his sisters who are typical and the parents. So we want to be part of the community. This is a corporate social responsibility to have this community. 85% of autistic adults are unemployed. Look at these numbers. This is massive. But there's ways of incorporating and hiring. These are things, part of Just Be is it has a training curriculum that's what we do. We train businesses how to become sensory friendly and welcoming environments. Once a business has been trained online or in person by, the training was created by Dr. Diane Koenig, they will get a certification. And then once they're certified, they can be uploaded onto the Just Be app, which is like a Yelp of autism. And then you'll be able to find all the businesses that create and have been trained and are welcoming. We call them safe zones. By putting the little Just Be sticker in the window, then we know that that place wants our business, is welcoming to our community, and will treat us with dignity, respect, and humanity. I just trained every Pinnacle bank in South Carolina, and they have this guide in their desk for all their employees. They've purchased fidgets. They have a sensory room. Agent-owned real estate agency is creating a sensory room. So when they have families that are coming here, a lot of families are moving to South Carolina, most likely they're going to have an autistic child. They're going to know what schools to put them in, how to create a sensory calming environment. So when they go to look at homes, they have sensory bags. They can come sit in an office that has fidgets and they dim the lighting to create a more welcoming space for any family member that wants to be included in this process. What does it mean to be autism friendly? Well, that's my Just Be sticker, and I'm here to make the world autism friendly and to make Charleston autism friendly. So it means to be kind. Here we go, to just be Southern. That's Southern hospitality. It's not a stretch. What does it mean to be welcoming? To be considerate? My son knows when you're whispering. He knows when you're pointing at them. We've even been filmed, which is terrifying. These are the things that we can do as a community. The autistic and the neurodivergent community is the largest untapped market in history. This is a human rights and a civil rights movement. I do believe that every great community has their moment in history, and this is the neurodivergent moment. This is our training that's online. You just go to the website, just be the change, and then you can go online. It takes about 35 minutes. I'm not here to make you a therapist or to certify you in that. I'm here to teach businesses. Every business, especially the Gen Z and the millennials, every family business, whether it's finding a dentist, finding a church where you can pray, finding medical, a babysitter, an agent, what's happening in our community. That is all on the app. But in order for you to be on the Just Be app, you have to be trained. So it's a social impact app. You can't just be on it. So families like myself, I call it the power of the pocketbook. If pizza's pizza, then I'm going to go to a place that supports a mission I believe in. You do not have to have an autistic child to support this. Businesses have been doing this for a long time. There's plenty of apps out there, whether they're just for vegans, pet friendly, Black-owned businesses, women-owned businesses, minorities. Well, now we are creating a community for the neurodivergent community. This is what's so important. And this creates what I consider a movement. Here's the app. Once a business has been trained and goes on the Just Be app, they have those little bumblebee symbols. You can go on and you can find anything you want. And the business has an opportunity. The app is still beta, but you can still have the opportunity if you're a business, whether you want to advertise, maybe you want to just create sensory friendly hours, bee friendly hours. Maybe your business is slow from 2 to 4. Those would be inclusive hours that I know I would come in with my family and feel welcomed. You could round up, you can give a discount, you can donate, or you can host an event. I partner with Town Center and we're doing Lights and Love on December 3rd. We did it last year. Originally, I spoke to one of the head executives over at Town Center, and she didn't understand why we couldn't come to the lighting of the tree with 5,000 people. And when I let her know that that would be a nightmare for my son and my family, and we didn't feel like being the unicorn for everyone to stare at us as he has a meltdown. So we created Lights and Love. We did it for the first time last year. It's a holiday, Christmas, Hanukkah event for families to come out. We had 300 kids come last year and they met Santa for the first time. And this year, Town Center has added 8 extra hours to have Santa there for sensory hours for families to meet Santa. These are things we don't need to change the child or the young adult to fit the environment. We need it, we just need to change the environment to fit the child or the adult. It's an easy fix. More about the app. So you can see once you get on the app, you can say whether you recommend this to the neurodivergent community. Is the Just Be sticker visible? These are the things that families can be able to write and to leave reviews so that we are working as a community to create these spaces that we know are welcoming and they want our business. One of the most important things is I've seen in schools is the no bullying. I don't know if it ever worked, but I've witnessed it firsthand that it really excludes special needs, special education. And right now, if your child is 2.5, most likely by the time they hit high school, 90% of their class will be on the spectrum. Whether it's ADHD, dyslexia, Tourette's, Asperger's, autism, intellectual disabilities, there is a sensory issue with most children. They say it's 1 out of every 5 kids has a sensory issue, some type of sensory processing. So I found that one of the most important things is to learn how to just be my friend, which is a campaign I would like to launch in the schools of education and awareness, how to be friends with Rio, how to be friends with my son. A lot of these typical kids don't have that understanding. They haven't really been taught. And then children are pure. So when they are taught how to become friends with someone that might have a disability, it speaks volumes. And this is a really big goal. I wrote a book, Rio and Bumblebee, talking about autism. We have a training curriculum for kids to go through the school system of how to be a friend and what is autism and what does it mean to be a good friend to a person with a disability. So these are the things that we can start with our younger generation of kids because they will have the lasting effect. And this is going to become the new normal. When you're 1 in 36, last year it was 1 in 48. When my son was diagnosed in 2010, it was 1 in 157. The numbers keep going up. Autism is a diagnosis, it's not a disease. An individual with autism is going to live a full life expectancy. Their life expectancy is not going to be shortened. The average is one of the oldest men who was originally diagnosed with autism just died at 89 years old. So there's a full life. And an individual with autism is going to cost anywhere between $1.4 to $2.4 million in his lifetime individually through taxpayers' dollars. So I started this idea to just be Southern. This was the campaign to make Mount Pleasant certified as the first autism-friendly town. And with the work of all the council members and Mayor Haney, we made this possible. It's one of the things that we really believe in. We went on to the All-American City competition in Denver and we won. And we won on inclusion, like I said. So this was a big win for us. And from now on, Mount Pleasant will be known as a certified autism-friendly town forever. This is part of the legacy. We believe in Mount Pleasant with Mayor Haney that this is an opportunity to be the true DEI, to be inclusive and not exclusive, that every child should be able to have the same quality of life as every other kid. My son should be able to have the same quality of life as any typical child, and that we are the community. Mayor Haney said, you're the voice of the voiceless, and we need to hear you, and that you are our families, and we work for you, and we want to make sure that your children and young adults have a wonderful life and are part of that fabric of our town. They've doubled down and bought us the Beehive. So yes, Mount Pleasant just purchased the Beehive, which is going to be a sensory trailer. This is a safe zone for families to be able to go anywhere, whenever it's blessing of the fleet or the bridge run or the lighting of the tree. From now on, the autistic and the neurodivergent community can be present at any event, that we are welcomed. And if our child is having a hard time, we can go into the Beehive. It's a reset. It's all sensory with LED lightings. It's a calming space. We have the sensory bags and headphones for them. This is a big opportunity. I know when my son was diagnosed, I had to sit there and just let go as a mother, to let go of everything, to know that he'll never have friends. We'll never do birthday parties. He may never get married. And we sit in our house and watch everyone have this beautiful quality of life as we sit on the sidelines. The Beehive is an opportunity to stop all that, to let these families shine and let these children thrive and celebrate being them, to just be themselves. Here's some of the sensory bags and kits. This should be at every place in Charleston, whether it's the Visitors Bureau, the aquarium. A sensory bag can change the dynamic completely. The headphones, again, autism, everything is heightened. Sense of sound, smell, taste, everything, noise, sight. That's what makes the sensory overload. Autism and ADHD has been in our genetic pool for 10,000 years. It is not a mistake. These genes have been selected. There's a big hyper focus on systems, a lot of individuals that are autistic, they have specific genres that they enjoy. A lot of them might know a lot about trains or anything that they fancy, but this helps them navigate through the community because most of the times they just might feel too overloaded. And this could help them be part of it. And offering this at any important establishment in Charleston can make the difference, whether it's you're at the airport or you're just going to go on a tour of beautiful Charleston. This is a game changer, these kind of kiosks. And of course, the yellow and black just means that they're a B. A lot of the time, identifying an individual with autism has been these name tags that are like, I am autistic. I am Rio. I am autistic. No, he's just Rio. He's not autistic Rio. He's just Rio. But he can just wear the headphones and say, he's a B. That's it. It gives a nice opportunity to have that kind of privacy. A lot of parents feel shunned upon and they feel a little bit nervous to always have to give their disclaimer of who their child is. A family shouldn't have to do that. Nobody should always have to put a label on who they are. Nobody needs to be high functioning or low functioning. That's not the world I want to create. And I've seen firsthand how it affects my son. Community outreach, here's some of the things that Just Be has done, whether it's creating these shopping centers with silent shopping hours or, being part of the battery or doing the yellow pumpkins, creating these are lights and love. All these children were autistic and they got to just be themselves, which was really exciting for parents. I was the first time I ever saw a parent say, my son is out there. He's on his tippy toes. He's flapping away and he's having the best time of his life. And I'm not worried for the first time. That's what Lights and Love created for many families. This is me. My background. A mother on a mission. In my formal life, I was a professional dancer and choreographer. I worked in the entertainment industry for 23 years. I've been fortunate enough to travel the world and work with many celebrities, but my true passion is always going to be my family and my kids. And when I was kicked out of that restaurant that night, everything changed. Most people want to know, what's causing autism? Is there a cure? How do we fix this? Why is it increasing? This is Dr. Diane Kulanane, who wrote the training curriculum. We don't know. Nobody knows what's causing autism. But what we do know is that the numbers are getting higher and higher. So my question for you in Charleston is, if not now, when? When are we going to do this? When it's 1 in 5? How many families do you know that are affected by autism? It is so close to home. And again, there's no look to it. How many times can you go out and have to defend your child and yourself as a parent? This is our moment for equality. This is our moment to be part of the community. And I truly believe when more families are out in public, the stigma will go away. So Just Be Southern is an opportunity to create a city that is inclusive, that is kind, that has a deeper understanding. I know when I got my son and he was diagnosed, my world changed. My eyes changed forever. I say that I believe the reason why there's so many kids that are being born autistic is because they're here to cure us. We are the circus. Look at our world right now. But once you work with an individual or have a child on the spectrum, your eyes change forever. This is the moment that we can create something so impactful to change the dynamic of the future of these families. And most of them are single moms, single dads. They might have 2 or 3 kids on the spectrum. They need your help. And as leaders in the community, you can change the dynamic in the future so that together we can all just be the change. And this is just B. So thank you so much.
Thank you, Layla. Thank you so much. Appreciate the all the great information and your passion for this too. We really appreciate it. Any questions for Layla on this? Well, Layla, I don't know. Have you? Oh, I'm sorry. Was
No,
someone
no,
trying
no.
to speak?
I'm like,
Okay.
no questions.
I did want to ask you, I know you had put the police logo up there, and obviously I don't know if you've reached out to anybody else with the city yet, or is this the first attempt? You know, just I want to know that for my own information, just see where we need to go from here, I guess.
Well, I am in the process. I'm going to try to get a resolution and try to get this up for legislation because this is a game changer. And so I've been told that in South Carolina, the pink heart was started here in South Carolina for donors. So if we can do that, we can put the B on it and then we can roll this out. And I have no doubt that this wouldn't go state by, this would go nationwide, state by state. I truly believe that this is the biggest game changer. It will save so many lives. So with Charleston, I mean, Charleston's the sweetheart of the South. Whatever Charleston does, everyone's going to follow in the footsteps. So you have an opportunity to create a national and international branding of a state, a city that protects individuals that are neurodivergent to be their voice. I'm my son's voice. He has no voice. I'm his voice, but I'm the voice of millions of others just like him. I'm a mom. I walk this walk every day. This isn't just in April where it's Autism Awareness Month. It's year round. And I believe that the safety component, I have talked to first responders, I have talked to police. You do have, when you get a driver's license in South Carolina, you can mark that you have autism. I have not seen that in other states. There's very few states that do that. Actually you can mark that when you get your driver's license. But what you do have is an I, it's called identified disabilities, and it's on the driver's license. Kind of hard to see, but if you talk to police officers, most of them have never heard of it. They don't even know what it is. I've only met one police officer that did know, and that's because he has an autistic child. But identified disabilities can mean anything. That's not autism. Autism is very specific. So, I mean, that kind of immediately having that symbol would change the dynamic of any interaction with law enforcement. And most children or young adults that have encountered law enforcement, there's a disconnect. There needs to be some more education and processing to be able to coexist with each other. A lot of the times, the individuals are terrified of law enforcement. So we need to work on that. They need to have the symbol, the B, so they can recognize it. The puzzle piece tends to be a little bit controversial. Autism was originally, the color is blue because they originally thought only boys were autistic. The autistic community does push back against the puzzle piece because they don't feel that they're missing any piece to the puzzle. There are a lot of girls that are autistic. Originally, they didn't think girls could be autistic. Most of them get diagnosed in their teens or early 20s. They do a thing called masking where they can copy and paste the emotions so that they can navigate through the world as acting typical or normal per se, but inside they're full of anxiety, which makes it really hard for them to gauge predators, people that might take advantage of them, sometimes human trafficking. So there's some deeper, darker parts of autism that need to be explored. And that would be why it's so important if law enforcement had this nice relationship with the neurodivergent community, that they could seek them and know that they're there to help them or to save them or to have that kind of understanding. As of now, we don't really have that.
Yeah, well, thank you so much. I really appreciate it. We can take as a city, we can certainly take a deeper dive into this, take a look at where we go from here and see how we can help you out from here. But thank you so much for giving so much time. Great presentation, a lot of great information. And again, I appreciate all the passion you have for this. And
Thank you.
but outstanding job of relaying this information to us. So,
Thank you. Does
thank you
anyone
so
have
much.
any other questions?
Yeah, I have a question.
Thank you. Sorry.
You'll just be quick. So I'm Jennifer Brush. I'm with the Charleston Dorchester Mental Health Center, as Paul mentioned earlier. And we don't treat autism specifically, but obviously the spectrum is huge and we do serve a lot of kids. I was wondering if you, and I just want to say what you have just, you're taking on the world, and it's a beautiful thing. And thanks for all that you're doing. But I was also wondering if you would be willing to do a training for our staff, at least so that if at the very least we have a resource that we can give to families and connect them with you and everything that you're doing. It's just wonderful.
Thank you so much. I would love to. I mean, that's what this was created for. I mean, my night turned out to be terrifying being out there with my son, but through that call to action, you find purpose. And to answer your question and to take that compliment, never underestimate a mother. That's all I gotta say. Mama bear, when it's your child, you see a world that's unstoppable. So I appreciate it. And I would love to work with any of you, to train you, to get that link up or do it in person, because this is valuable information. Sometimes with training, it becomes very medical. We just need to know the identifiers. We need to know how to do these quick commands or how to navigate in your workspace. These are the real tools. There's a lot of businesses in autism. It's a big business. I know that, but I live it and I want to share what's really happening with the families. What are the newer terms like masking, rapid prompting method, what these families really are seeking from their officials and their community. And I would love to do that.
Thank you, Layla. I wrote down your phone number, so I'll call you.
Perfect. Thank you. Thank you. Any other questions?
Will you be able to share those slides, or Paul, would you be able to share those slides?
Yeah, you can share all the slides.
Nick asked that. So
I have the PDF I'll send out after the meeting.
Perfect.
well, very good. Well, thanks again, Layla. We look forward to working with you in the future, and appreciate that.
Yeah, I look forward to making Charleston an autism-friendly city for all the families to come and enjoy, because it's one of the most beautiful places in the world. And now we're going to make it just be Southern.
There you go. Very good. Well, thanks again. All right, so we'll move on in our agenda here. We've got our community health update. I'm going to call on our South Carolina DHEC local medical director, Dr. Katie Richardson.
Thank you. I just wanted to give 2 shout outs for articles that were in the Post and Courier this past week. The first one was the article on the pedestrian deaths in Charleston. Charleston is actually the 5th most dangerous city in the country for pedestrians. Statewide, there were 171 fatal pedestrian auto collisions last year and 130 so far this year. And a few of the recommendations that were pointed out that I think are important to repeat are asking pedestrians to use crosswalks and really look both ways carefully before crossing the street. Drivers to be cognizant of pedestrians, especially at night when 80% of pedestrian deaths happen. Certainly drivers should never leave the scene, and some of the stories conveyed in this article were about hit and run accidents, and that alcohol is involved in nearly half of these deaths in South Carolina. And so whether that's the pedestrian or the driver, certainly that's an important risk factor. So I would love to see this committee maybe do a deeper dive into what more Charleston could be doing to try to decrease these pedestrian deaths in the city. On a more positive note, on Monday was the groundbreaking for the Ashley River pedestrian and bike bridge. And I'm very excited to see that bridge go up. And I know it's taken a lot of work and a lot of commitment by many to make this happen. And this again is the groundbreaking for that. So just wanted to bring those two things to light. As far as our respiratory illnesses, which we often call influenza-like illnesses, basically they're continuing to creep up. But it looks like we're sort of setting up to being not as bad as last year, but worse than pre-pandemic years. Looking at just some more demographics, the South is starting to creep up more with these respiratory illnesses than other parts of the country currently, and we're definitely seeing more kids in the sort of 0 to 4-year-old range, our youngest kids, beginning to show up in emergency rooms with respiratory illnesses. Thankfully, our COVID rates have decreased since last month. They are plateauing, and really for the best information around COVID-19 in our community, MUSC continues to put out the COVID-19 Epidemiology Intelligence Project. That's updated every Friday. And then DHEC has on Wednesday, we update a flu watch and a respiratory disease watch, which includes RSV and COVID in addition to flu. What we are concerned about with COVID is that that virus continues to mutate at much higher rates than many of our other viruses. So because of that, we are concerned that we may have another wave around the holidays. That has been the case over the past several years. We are not expecting it to be as bad as last year, but if you've not gotten your new booster, now is the time, so that it provides maximal coverage for the holiday season. Likewise, our flu rates continue to be low and stable, but we did in the last flu watch last week see an increase in the low country region. So now is the time to get your flu shot. It takes 2 weeks to be active. And then with RSV or respiratory syncytial virus, we are seeing increases already. We had a very early season last year with respiratory syncytial virus and are beginning to see that already this year. The CDC does not predict that it will be as high as last year because of some immunity that we gained last year. And thankfully, we have new vaccines and medication. So pregnant women, adults over the age of 60, and infants should all be talking to their doctor or provider about ways to prevent illness with respiratory syncytial virus or RSV this year. So now is the time to get up to date with flu and COVID vaccines and talk to your provider about the RSV vaccines that are available. And lastly, I want to give a shout out for World AIDS Day. That is December 1st every year. That is a time to remember those who have died from HIV and AIDS-related illness, as well as celebrate the progress we have made in reducing stigma and in reducing HIV transmission in our community. So that event will be on December the 1st at the Unitarian Church in Charleston. I'll send the specific information, but it's in the evening, always on that day. And then we will also have a free testing day in honor of World AIDS Day on December 5th. That's all health departments. That's all sexually transmitted infections and HIV. Testing will be free of charge that day. We do ask that appointments be made, but walk-ins will be accepted as we have available time. That's what I have for today. Thanks so much.
Very good. Thank you, Dr. Richardson. Any questions? I see Paul has his hand up.
Katie, I just was questioning on the article that was in Sunday's paper about the schools grappling with alarm student fitness data. Is DHEC, I know where all those come from, but I just thought that was, we expected it. Because we have seen less activity and that's just one of those another items I want to see on our agenda, because I think we need to try to take the lead and try to do it. I decided last night that Halloween was my favorite event because I saw so many parents walking with their children, at least blocks to go around for trick or treating. And I said, man, this is it. We need to have Halloween more often or something to get people out walking to do fun things in their communities. So.
Yeah, absolutely. That would be the third article that I should have given a shout out for today. Yes, we do have a lot of work to do. Holly Cutt was was quoted in that article. I think she's doing great work at Charleston County School District in getting kids moving. And I think she would be a wonderful person. Maggie can chime in, but to come and speak with us about what is being done in our public schools to get kids back on track as far as both healthy weight and physical activity.
Very good. Any other questions for Dr. Richardson? Well, thank you for that update and report. We appreciate all that you do, obviously, all the time for us, for our committee and our community. So thank you so much for that. So we'll move on to our health and wellness updates. Not to put her on the spot, but I did want to introduce you to April Slinker, who is our new nurse with the city of Charleston. And I think she's been with us about 3 weeks. And I just want to say welcome, April. And you're welcome, not to put you on the spot, but anything you'd like to say to our group, we'd love to hear from you.
I'm still trying to get my footing a little bit, but I couldn't be prouder to be here. And I feel like the things that especially this team is working on, they're spot on. I think a lot of our community needs, we've got to get past the COVID years, and we've got to get some of our routines back and some of the things that kept us healthier and our immune system stronger. So I'm glad that we're focusing on some of those items. So I'm working internally with the city staff, and so I'll be driving some of that hopeful behavior and getting people more active and maybe giving them alternatives and food choices and just information and resources so we can have a healthier group.
And Kevin, I'll add that we know she's a good stock. She came from Jennifer Brush's program at Department of Mental Health, so we know that she has a good foundation.
It's true.
Well, we're excited to have you, and anything that I can do or anyone else as far as city council is concerned, reach out to us. You've got our support, and we appreciate you being with us. So thank you so much.
Thank you. I appreciate that. Thank you very much.
And I guess, as far as our health and wellness updates, if you have something, if you want to just raise your hand, let me know if you've got updates. We can kind of go from there. So anyone else with updates you want to share?
I have one, but I can't figure out right now how to raise my hand. It's not working.
Oh, please go ahead, Jennifer. Yeah, thank you.
It's just a quick one. So as you all know, we have an associated nonprofit called Mental Health Heroes that puts on our conference with us every year. And I just wanted to invite you all to our second annual oyster roast that we are having on Veterans Day, which is the 11th, that Saturday. I believe Mayor Tecklenburg is coming and going to do the welcome, actually, but it is going to be on Daniel Island at Waterfront Park. And I think there's going to be yoga at 11, and I think it's about from 11 to 2. We'll have oysters and lots of activities for kids, and it should be a fun day. And so I can send Paul the flyer to send out to this group. But again, Mental Health Heroes raises money to help care for patients of the Charleston Dorchester Mental Health Center, pay for medications, emergency needs, all kinds of things. So I just wanted to share that with everyone, and I will send a flyer to Paul after the meeting.
Great. Thank you so much, Jennifer. Appreciate that. Anyone else with the health or wellness update? Well, if not, I just want to tell you I appreciate your time. All of you I know are very, very busy, and the time that you commit to this committee is extremely valuable to Charleston. So thank you for all that you do, and thank you for sharing your time. I do see it's right at 10 o'clock. Some of you I may see at the South Carolina Healthy Business Challenge today, but for those of you that I don't see, I hope you have a great Thanksgiving, and we will look forward to seeing everybody again in December. So we don't have anything else to come before this committee. We stand adjourned. Thank you.
Thank you.
Bye, everyone.
Good to see everyone.